Welcome everyone to sqadia.com. My name is Osama and today we are talking about hemodynamic dysfunction. In the first part of this lecture, we are going to talk about hemorrhage and hyperemia. And in this lecture, in addition to hemorrhage and hyperemia, we're also going to talk about the types of both and as well as active and passive hyperemia. So what is hemorrhage? Hemorrhage is actually the escape of blood from vasculature, such as capillaries, veins, or arteries, into the surrounding tissue, as you can see in this picture here. So hemorrhage is usually caused as a result of trauma, and it can result from capillaries, which will result in slow and even flow because capillaries are small blood vessels. And the color of the blood would be bright red in color because it may be oxygenated. If we talk about hemorrhage from venous source, then we would see that the blood flow is steady and slow because of decreased venous pressure. And the blood is deoxygenated and it looks dark red in color. And when the hemorrhage source is from the arteries, then it results in spurting and pulsating blood flow because of increased pressure because of the pumping of the heart. And as the blood in arteries is oxygenated, so we would observe a bright red color. Hemorrhage can be of different types. Hematoma is a type of hemorrhage which is localized within the tissue or organ and it does not come out, as you can see here in this picture. So this is an example of hematoma in which there is an internal bleed, but it was not able to come out of the skin. And the second is petechial hemorrhages or purpura. In this, you would observe small punctuate hemorrhages in skin and mucosal membranes or serosal surfaces. The third is ecchymosis, in which there is diffuse hemorrhage in skin or subcutaneous tissue, as you can see in these two pictures as well. The next is the hemothorax. As thorax tell you what type of organs are located in the thorax. One of them is lungs, and they are actually enclosed in the pleural cavity. So hemothorax is actually the loss of blood, or the blood leaves the vasculature and comes into the pleural cavity, as you can see here. So this is the pleural cavity, and you can see that the blood is coming out of the vasculature into the pleural cavity. Second is the hemopericardium, in which the blood leaves the vasculature and comes into the sac which is enclosing the heart, which is also known as the pericardium. The third is the hemoperitoneum, in which the blood leaves the vasculature and enters the peritoneal cavity, as you can see here. The last is the hemoarthrosis. Arthrosis means joints. So this is actually when the blood leaves the vasculature and enters the synovial spaces of the diarthrodial joints, as you can see here. Now, what is hyperemia? Hyperemia is also known as erythema. It is defined as a localized increase in the volume of blood in capillaries and small vessels. One good example would be if you heat any part of your body, you would see that the skin becomes red because of vasodilation. So that is actually an example of hyperemia or erythema. There are two types of hyperemia: active hyperemia and passive congestion or passive hyperemia. In active hyperemia, there is localized arterial dilation, for example, as in heating, blushing, or inflammatory process. In passive congestion or hyperemia, there is actually obstructed venous return or increased back pressure, such as in congestive heart failure, so the blood is not able to go back. It can result in acute passive congestion or chronic passive congestion. In acute passive congestion, it is sudden and it is in a very short span of time. For example, in shock, inflammation, or sudden right heart failure. In chronic passive congestion, it is a slow process. For example, if chronic passive congestion occurs in the lung, it is usually caused by left heart failure or mitral stenosis. It is because of congestion and distension of alveolar capillaries leading to capillary rupture and passage of blood into the alveoli. That is because left side of the heart is actually responsible for systemic circulation, and when there is left heart failure, it is not able to pump blood into the systemic circulation, and the blood starts to pool in the pulmonary circulation, which is in the lungs. So that is why there is actually a congestion in the lungs. Phagocytosis and degradation of red blood cells which are coming into the alveoli occurs via specialized type of macrophages, which are also known as heart failure cells. If this process of congestion stays for too long, which is also called as long-standing congestion, then the fibrosis of the interstitium occurs and hemosiderin deposition because of red blood cells occurs as well, resulting in brown induration appearance of the lung. Chronic passive congestion can also occur in liver and lower extremities, and that is because of the right heart failure, which is responsible for pulmonary circulation. So what happens when right heart failure occurs? The blood starts to pool in the systemic circulation. This results in a nutmeg appearance of the liver, which is produced by a combination of dilated and congested central veins, and it is surrounded by a brownish yellow and often fatty liver cells. So that was all about hemorrhage, types of hemorrhage, hyperemia, and types of hyperemia, also known as arrhythmia, and active and passive hyperemia. Thank you for watching sqadia.com, and please do watch other sections of this lecture as well. Thank you.